Well, these new numbers are fresh signs that the more Americans learn about what Democrats are planning for our health care, the less they like it. A recent series of polls from places like the Journal, the New York Times, the CBS News, suggesting a majority of Americans now think these reform plans will increase our costs, limit our choices, and threaten our quality of care.
Our lead coverage this morning begins with Stephen Moore, senior economic writer for the Wall Street Journal, also wrote the book The End of Prosperity. Stephen, good morning and welcome back.
Good morning, Bill.
Analyze the numbers.
Well, you know, it's interesting because Megyn really nailed it. The more Americans are starting to understand what's actually in this $1 trillion bill that Barack Obama has put forward, the less they like it. And there's a couple of kind of leaps of faith in that bill that Americans aren't buying into, Bill. One of them is that you can spend $1 trillion on new health care subsidies, and somehow that's going to lower costs. Americans just don't think that adds up. And the other problem, which I think is an even bigger one for the Obama administration and the Democrats right now, Bill, is it turns out that the vast majority of Americans do have health insurance, and about 3 out of 4 of people who have health insurance, you know what, Bill? They kind of like the insurance they have. They like their access to the medical system.
So what they're wondering is why blow up the system for
exactly
for a small
one other quick point
number
about this, Bill, is that it's women, it's people like Megyn who are actually the healthcare consumers. It turns out about 2 out of every 3 healthcare dollars are spent by women, and you're seeing a real fall off in support of this plan by women who are actually the healthcare consumers, the ones who take their kids to the doctor in the hospital, and they're very suspicious, Bill, that this is going to lead to a decline in the quality of their care.
And it might not just women. I mean, look at this. Among those with private insurance right now, according to the poll, the proportion calling the plan a bad idea is up 10 points to 47%. Make that 13. That's wrong. It's 47% as opposed to 37% the last time they went out and polled.
Yep.
Another number here, also in the Wall Street Journal polling, only 2 in 10 said the quality of their own care would improve under the Obama plan. Just 15% of those with private insurance thought it would as well. The more it lingers, the more people find out about this. And, man, it's all about the economy, Stephen. I mean, that's what I keep coming back to. Unless you get jobs working again in this country and get the government to stop spending money, you're not going to get people on board your ideas.
That's right, and it really does tie to jobs, Bill. It's a very good point because, let's face it, about 70% of us get our health care through our employers. And, you know, if you look at this bill and you look at the other side of it, which is the taxes to pay for it, a lot of those taxes are levied on the backs of small businesses. That may require businesses to lay off workers. Then people lose their health insurance. So, you know what this is starting to look a little bit to me like, Bill, is Hillary Care, the same battle that we fought, what was that, 16 years ago. People, as they kind of got to know what was in the plan, the labyrinth of government agencies, they didn't like it very much.
We're going to talk to a Democrat in a moment. He doesn't like the plan either. We'll get his view in a moment. Stephen Moore, thank you. Out of Washington,
Bill, nice to see you.
And the Wall Street Journal, you as well.